Hi, I'm Holly Pavlisak, Program Manager for the Advanced Medical Technology Initiative, otherwise known as the AMTI program. The AMTI program facilitates bottom-up technology innovation at our military treatment facilities and operational units, exploring solutions that fuse data, humans, and machines, documenting their impact on performance, readiness, access, quality, and safety, which provides senior leadership with medical technology surveillance. Next, you will hear from some of our innovators on their AMTI-funded initiatives, so you can see firsthand some of these medically unique and militarily relevant solutions.
I am Zach Colburn. I'm a research scientist at Madigan Army Medical Center. As many of you know, sepsis is an uncontrolled inflammatory response to infection. It causes organ failure, and in 75% of patients who survive, it causes functional disability. It's also a very expensive disease. In 2013, it cost $23 billion in the US alone. It's particularly problematic for active duty service members because soldiers are exposed to conditions in which there are risk factors that increase the chances of developing sepsis. For example, puncture wounds and burn wounds. About a third of combat wounds become infected. So there's a high risk of sepsis in active duty service members. In 2019, there were about 13,000 cases of sepsis MHS-wide. And that points to its widespread impact. And at a cost of about $7,000 to $40,000 per patient, that equates to between $100 and $500 million to the MHS per year. So even small reductions in costs associated with treatment care would have a large impact, not just on patient well-being, but also on cost savings. Because there's that potential for a large impact when you deal with sepsis, a lot of people are working on this space, and most of their work is focused on diagnostics, and for good reason. The odds of survival decrease very rapidly for patients with sepsis as time goes on. So the sooner you can identify whether a patient has sepsis or not, the sooner you can treat, the better the outcome will be. Unfortunately, sepsis is a multi-endotypic disease, meaning that there are multiple contrasting manifestations of the disease. In some cases, blood cell counts may be up, they may be down, heart rate may be up, it may be down. And when you have a situation like that, traditional statistical methods for predictive analytics just don't cut it. You need to turn to more sophisticated tools. So we're turning to artificial intelligence. And rather than focus on diagnostics like most of the field is, we're going to avoid that saturated space and focus on prescriptive artificial intelligence. That is, we're going to try to predict what treatment strategies are most appropriate for a given patient given their current condition. The way we're doing this is we're pulling a whole bunch of data from medical records, and this would include vitals, labs, and so on. We're going to put that into a database, and the data in that database we're going to chop up into snapshots in time for each patient. And each of those snapshots we're going to cluster based on their similarity to each other. And because we know the temporal progression of patients between each of these clusters, we can predict how patients will progress over time. And that allows for prognosis. If you take that one step further and you incorporate information about treatment, then you're able to predict the impact that different treatments will have on disease progression. And that will allow you to determine which courses of treatment will lead to the optimum outcomes. And by optimum outcomes, we're going to be looking at mortality as well as sequelae in years following diagnosis.
If you would like more information on the AMTI program, please visit us at the following website: